Hi guys, and welcome to my very first English video today, and I'm glad you all are watching. And now you might ask why this, so I'll tell you. By popular demand, I'd like to introduce my book for English native speakers today. It's called Gesundheitswesen im freien Fall. That means medical healthcare system in free fall. And in this book, I've described the experiences and common reprisals against panel doctors in Germany. I've also drawn attention to the lack of care in all areas of health and critically examined the path of economisation that has been taken all over. My appeal in the context of my Facebook initiative, Healthcare is Not a Business, states clearly that healthcare must remain a service of general interest and that the path taken with disastrous austerity measures was wrong, as the COVID-19 pandemic crisis impressively has shown us. I plead for an early warning system and targeted measures for vulnerable groups instead of ill-considered political snapshots and radical measures that have led to massive collateral damage and existence-destroying consequences for the self-employed people amongst us. Is Germany's healthcare system really as great as its reputation? And my answer is no, not anymore. In the last few months, you've not received a doctor's appointment as late as for 6 or 12 months. You wanted to go to a specialist you haven't been for a long time, only to find out that the practice has closed without a successor. Visited relatives or friends in hospital and shook your head at the workload of nurses and doctors and the impact on patient care? No. I'll tell you, your area, your town, your city are no exceptions. You've not been unlucky. You've merely experienced both economisation, over-bureaucratization and mistreatment of health workers by politicians who've done to a formerly excellent health system over the last 2 decades in Germany. Currently, we're not only in the midst of the COVID pandemic, but above all, unfortunately, in the midst of an election campaign, and the issue is unfortunately being instrumentalized for power purposes. However, right now we have the chance to bring about change and to vote on whether we want to continue with the current health policy or not. We doctors experience the shortcomings in the health system firsthand in our daily lives. Every 5th practice is desperately looking for qualified medical assistance. The nursing crisis is imminent and economisation is rampant. In 5 years, half of the general practitioners and pediatricians will have retired. The DRG system is bringing hospitals to their knees. Politicians turn a blind eye to all this, while the pandemic has just demonstrated the failure. The economisation, over-bureaucratization and mistreatment of those working in medicine has become unbearable for us. Full-bodied promises of plans to combat the nursing crisis have remained empty phrases. We have witnessed disinfectant shortages, resource shortages, or lack of protective equipment in practices and clinics. We have seen that pandemic plans that had existed for 8 years have disappeared in a drawer, just like this. We experience the hounding, the recourse and the pressure of economisation on a daily basis, and we are caught in the hamster wheel of bureaucracy. At the same time, we experience discrimination in the distribution of vaccines, for instance. We are denied competence. Vaccination centers are set up as a distraction, but they fail completely. And we always have to pay for the disasters ourselves. The healthcare system has long since ceased to be a service of general interest, but has degenerated into a tough business and a self-service shop for the boss and for officials of the health insurance funds. In the end, after all, it's the patient who suffers, and the society is divided. I'm pleased to be able to present to you my book today, hot off the press, and I'm looking forward to your feedback eagerly, because this book takes you on a journey through the dark spheres of medicine and depicts our everyday lives as doctors in Germany. Awaken with me from the dream of the once supposedly world's best health system. This book sheds light on this from the point of view of a person affected. However, the analysis wants to go beyond a personal report. Therefore, the developments are presented for the different areas of the healthcare system in Germany, for nursing, for example, for the doctors in the clinics as well as in the outpatient practices, for the public healthcare system, pharmacies, as well as patients, and especially for the chronically ill patients amongst us. As is well known, knowledge is the first way to improvement. So the book therefore wants to name the problems, because naming the problems and causes is the first step in seeking and finding solutions. The whitewashing of all undesirable developments by politicians and health insurers does no good but harms and prevents goal-oriented solutions, in my opinion. If the wrong decisions of the last 20 years are not corrected, the next pandemic will hit us much harder and worse. Our further reduced health system will no longer have a chance to ensure the necessity and the help for the people in need. We must understand and act now. I hope in particular that politicians will take action for a future-oriented and strong Germany. Cosmetics and whitewashing will not eliminate the nursing crisis and the shortage of skilled workers. Let us, therefore, fight together for a just, united, and healthy Germany. Will we learn anything from the corona pandemic? What do you think? Write down your comments. Take care. Bye-bye. See you next time.